A warm greetings to all present here. We have almost come to the last part of the Enriching and Enthralling Anicon 2022. I am very sure that the entire content of the program has given us great insights to ponder over the various facets of invest in nursing and transformational leadership. Nurses have the potential to lead the way in improving health and healthcare for all. But in order to realize that potential, they must operate in an environment that is safe, empowering, and satisfying. Your work environment impacts your mood, drive, mental health, and performance. When you have a positive work environment, it can improve your happiness, increase your productivity, and motivate those around you, and encourages employees to perform to their highest ability. Today, we have an array of eminent leaders from hospital and hospitality industry to grade this wonderful vocation and take us through the importance of having healthy working environment. May I take this opportunity to introduce them all to you. First goes Mr. Ayan Jubair. He is currently the area director, Hyderabad, for 5 IHCL hotels, including Taj Falknuma Palace. Ayan is an alumni of IIM Ahmedabad and Nanyang University, Singapore, and has got over 25 years of rich experiences in the hospitality industry. He has started his career as an young executive and has worked his way up doing several roles in various destination hotels, including the Taj Exotica in Sri Lanka. He was also chosen as a part of a core team to drive financial margins through revenue management lever across all leisure projects. Taj is known to be a business giant and for employee welfare. We appreciate Mr. Dubey taking time out from his hectic schedule to share the culture of hospitality industry. Then comes Dr. Sai Lakshmi Gandhi. She is MSc in psychiatric nursing and PhD in nursing and currently working as professor and head of Department of Nursing, NIMHANS, Bangalore. She is also nursing consultant in the psychiatric rehabilitation services and geriatric psychiatric services. She guides and leads innumerable research projects as co-investigator and principal investigator and has been the recipient of various awards, fellowships, and recognition, including the most prestigious President's Gold Medal. Then comes our very own anime member, Ms. Harita Vijan. She is a passionate and highly motivated nursing personnel and is currently holding the General Manager Nursing of Krishna Institute of Health Sciences, Secunderabad. She is also Telangana Chapter President of ANI. She has got over 20 years of rich experience in hospital and academic settings. She holds a master's degree in CBT nursing and hospital administration. She is also a certified USIM simulator instructor from Norway and a scientific member of IEC. Here goes our international ANI member, Ms. Viji George. She is MA, BSN, RN, RNC, and NIC. She works as a Clinical Excellence Program Manager and Magnet Program Director at Texas Health Resources. Her career expands from military nursing officer to various nursing administrative roles. She has done professional publications and presentation in national and international forums. Her international ventures include Sigma's International Leadership Succession Committee member, Global Leadership Mentoring Community member, and co-founder of Indo-American Evidence-Based Practice Fellowship Academy through collaboration with Johns Hopkins. Her accolades include awards like DFW Great 100 Nurse, Nurse Excellence in Leadership, and Visionary Leader. She is currently pursuing her doctorate in nursing practice in the nurse executive track. We are very glad to have you all. Now, may I have the pleasure to welcome Ms. Haritha Vijayan to present the unique study, which is one of its first kind, which was taken up by Association of Nurse Executive of India, and which had almost more than 1,800 nurses response collected through our research committee. So we will see Haritha presenting the study in detail. Welcome, Haritha.
Very warm greetings to everyone. I am extremely proud to present this study, which was done by Association of Nurse Executives India on healthy work environment of nurses working at various hospitals across India. Give me a second to pull up my slide. I take this opportunity to thank all my project team members for trusting me and giving me this opportunity. This was an exploratory study to identify various selected factors which are influencing the work environment of nurses at various hospitals across India, having the aim to explore various such factors with the objective of identifying various factors influencing the healthy work environment. The design of the study was an online survey consists of all registered nurses using the convenient sampling technique with a sample size of 1834. The data collection method was using the Google form. The survey was categorized into 4 major components such as multidisciplinary team support, dignity empowerment and nursing leadership, organizational factors, and rewards and recognition. Moving on to the analysis of demographic variables, 86%, that is a large sample size, were the female, followed by 62% from the generation of millennials. The type of hospital, more than 300 bed facility of 56% and private sector consists of 95%. The state participation of 24.5, the highest from Karnataka, followed by Kerala of 16.3 and Maharashtra of 14.9. The level of nurses are the bedside nurses of 68%, and from that, the critical care nurses contribution of 43%. 57% of them are the graduate with experience of 1 to 3 years of 25% and more than 10 years of 23%. Moving on to the further analysis of the study, the first component of multidisciplinary team analysis team support. The analysis clearly indicate the promising result of multidisciplinary team support. However, there is a significant dip as far as the support from MRD, physiotherapist, timely visit of a doctor when a new case arrives, and the dietitian. The least percentage in the category of 58 and 51% for the arrangement of blood on time and on-time delivery of food without the nurse follow-up. Moving on to the second component, that is a dignity, empowerment, and nursing leadership. The subcategory of verbal and physical abuse. The analysis clearly says that the nurses are verbally and physically abused while they are on duty. Further, looking at the verbal abuse, the major contribution of 27% were from the patient, attendant, and the doctors. As we all agree and know that there must be no for physically abuse on duty. However, 7% of the population underwent physical abuse while on duty. When we look at the correlation analysis of physically abused while on duty, clearly says that the high percentage of 37 were from the critical care nurses, followed by the ward and other areas. The victims are majorly the bedside nurses and the team leaders. The level of experience was not really matter here because all level of experienced nurses were physically abused. Moving on to the second correlation, that is shouted in workplace, in public. ICU bedside nurses with experience of 1 to 3 years were faced such kind of act in the public. The second component for the category of support and training, 92% of nurses are happy for their seniors. They say that they are kind and listen to them. However, there is a major concern as far as their working hours are concerned. 27% of the population work more than 16 hours whenever they do the double duty. 33% of the population work more than 218 hours as a routine per month. Looking at the correlation analysis of major two factors, that is maximum hours of working and overtime in a month, we can clearly see that 36.5% of nurses are working between 203 to 218 hours as routine in a month, followed by 66.7% work more than 16 hours whenever they do an overtime in a month. This population are basically from the critical care unit bedside nurses with experience of 1 to 3 years of major. This is the category we know that at still in the learning process. So putting this group at a larger exposure as far as the working hours is concerned can definitely create kind of error at their bedside. The second category of correlation, that is seniors are not kind and listen to them. 41.8% bedside critical care nurses with more than 10 years of experience says that the seniors can be much more greater as far as the kindness and listening skills are concerned. Moving on to the third component, that is organizational factors. This really require a tremendous amount of attention and improvement. The larger percentage of nurses felt that they really don't get undisturbed time to supervise the patient meal, handover process, and medication administration, the core activities of nursing care. There is significant delay as far as the discharge summary, lab reports, maintenance, and equipment repair is concerned without the nurse being following up for the same. Further categories of the organizational factors, we can see here that the no provision for the clean toilet on duty says around 36% of population. In that, 46% says that there is no place for them to take a short break while they are on duty. So correlation factors from the previous slide, the first important factor of no access to clean toilet while on duty, irrespective of the experience and the category, all nurses felt, that is around 67.8% felt that there is a larger requirement to have clean toilet while they are on duty. Though all the majority, or that is 95%, were participated from the private sector. The second correlation of no place to sit down and document, 74.2% critical care bedside nurses having 1 to 3 years of experience opined that there is no place for them to sit down and document without making the error. Correlation of no place to take break while on duty, across all unit, bedside nurses express the concern of not having a designated place to take short break while on duty. The fourth component in the survey, that is rewards and recognition. So this particular aspect really require further attention. 39% of the population felt that there is no appreciation from their supervisors in last 1 week, followed by 30% in last 1 month, and 22% says that in last 6 months. 8% of population opined that there was no discussion about development and learning needs at all during their journey in the organization. This particular question is the essence of the survey. That means how likely are you to recommend the nursing employment in your current organization to your friends and colleagues. The detractors of 35%, followed by the passive of 31%, and promoters of 34%. Further analysis of the promoters category, we can see the bedside nurses from the critical care unit with experience of more than 10 years are larger the promoter category. Employee net promoter score of 1.9 clearly indicate the need to improve the nursing experience and satisfaction. So this can happen only by investing in nursing. Recommendation from ANEI based upon the study, very important for us to understand and further take it for implementation. So when we recommend and what nurses are asking, we can clearly see that the basics of basics are the requirement for nursing. Every institution strongly have a policy on no shouting at the workplace. There must be zero tolerance policy for physical abuse and must encourage the staff to speak up if something like that happens. Elimination of non-nursing activity and allotting more time for the patient care is one of the recommendation which is very much essential, so thereby the patient safety is ensured. Must conduct assertive communication workshop among all multidisciplinary team, and supportive department must deliver the timely service without any reminders by the nurses. We must ensure the mandatory breaks during the duty and the leave as a policy by the institution. Create nurses lounge wherein the nurses can take short break while they are on duty. Must organize and facilitate the clean toilet and seating arrangements for the nurses while on duty. This questionnaire of the healthy work environment by ANEI, the sample survey questions can be used by the institution while they do or perform the employee satisfaction survey. Periodic schedule for rewards, recognition, and developmental discussion is another strong recommendation based upon this study. This particular study, to summarize, that it is a time to invest nursing, thereby we can create a healthy work environment for nurses wherein they look after the patient, patients are safe. Thank you.
Thank you, Harita. Your presentation gave much required insights into the current status of working environment for our nurses, and you discussed the very important and most critical four components: healthcare organizations and nursing leaders, how much to deliberate on and bring solution to the recommendations. Now, moving on to the next speaker. Magnet status is the highest credential for nursing facilities in the United States and around the world. To be certified as a Magnet hospital, a medical facility must satisfy a set of criteria created by American Nurses Credentialing Center to measure the nursing excellence. The Magnet model provides a framework to achieve excellence in nursing practice and serves as a roadmap for organizations seeking Magnet recognition. And they serve as the source of knowledge and expertise for the delivery of nursing care globally. Now, may I call upon Ms. Viji George, our international member from USA, to present her insights into healthy working environment, a Magnet experience. But I regret to inform that she couldn't be here due to vast time difference. So let us hear what she has to say in her presentation.
Greetings from the United States. It's my true honor, privilege to be part of ANICON 2022. As part of ANI's international member, I'm going to be speaking on a very important topic on a healthy work environment in this Transformational Leadership Conference. Let me now pull my slides. Hello, my name is VG George, and I work as a Magnet Program Director and Clinical Excellence Program Manager in a major healthcare system in the North Texas area in the United States called Texas Health Resources. From that Magnet experience, I want to briefly mention about how Magnet can improve healthy work environment. To understand that, we need to understand what is Magnet. Magnet is a coveted accreditation. It is an international recognition of nursing excellence by the American Nurses Credentialing Center. It's the highest recognition for nursing excellence. Basically, it is a journey to clinical excellence. There are many tough standards to be maintained to attain this accreditation. As of April 2022, 9.3% of hospitals, those are registered in the United States, are Magnet designated. Magnet experience is based on the Magnet model. As you can see here, that the major focus is in resolving global issues pertaining to nursing and healthcare. It has 5 elements, and it is focused on the empirical outcomes. As the theme of this conference goes, transformational leadership, and that is one of the most important elements of Magnet model. That set the foundation for the healthcare experience in the healthcare organization. The transformational leadership sets an environment that improves or empowers the structure of the organization. The structure involves the workforce, the process in place to provide the best care to the patient as well as the people who work there. When that happens, it leads to exemplary professional practice. Exemplary professional practice is not something to attain. It's a constant journey, and you have to keep up with all the innovations, new knowledges, and improvements so that whatever is happening latest in the healthcare is implemented. So research, evidence-based practice are some of the key components of these elements to be maintained so that together all these things can lead to empirical outcomes, not only for the organization, not only for the patients, but also for the people who work there, mainly for the nurses. So what does Magnet mean for the organization? When you have a great structure and work experience and process in place, definitely it's going to yield to great outcome, and it's going to attract and retain the top talent. The business will grow, and of course, financial success, and all these things is going to lead to a long-term sustainability. When everything is on top standards, when excellence is something to be achieved almost every day, it is going to yield that organization to the journey of the high reliable organization. It ensures that the community value, if I want to go for my healthcare, if I have a choice, it's a Magnet hospital that I'm to go to get my care. Gone are the days when the professionals are working in their own silos. Magnet culture promotes interprofessional collaboration. So it fosters that everyone work together to improve the professional practice for the great outcomes. The quality initiatives are based on the latest out there, so evidence-based practice is the norm. For a patient, you're going to get the best care, the improved care because of the improved safety, improved quality, and all these things is going to yield to a great satisfaction. The nurse-sensitive indicators that is directly related to the nursing care a patient receives is going to decrease the falls rate, the pressure ulcers, the infection rate, and definitely it's going to affect the mortality rate. So compared to a non-Magnet hospital, Magnet hospitals have decreased mortality rate. And for a nurse, I'm working in a Magnet hospital or Magnet organization. What does that mean to me? I have the autonomy to practice my profession to the fullest potential. As a person, I can work to my fullest potential based on my talents, my skills, my knowledge, and my aspirations. So I'm part of an environment where my decisions matter. I work in a collaborative environment with other professions, and it improves my efficacy and efficiency in my work practice environment. I have all the opportunities for professional development. Nursing research and evidence-based practice are part of this, where I can get involved in these or lead these projects to improve outcomes. My voice matters. If I get to work in an organization like that, I'm going to be very happy there. So that's going to improve job satisfaction and retention. And I proudly say this is one of the organizations that I work the most and the longest. So other things that mean for a nurse who's working in a Magnet organization, there is decreased burnout because the staffing ratios are much better, and decreased turnover rate. When you're happy in a place, why do you want to leave that place? There are improved nursing standards because all these standards have to be achieved to maintain Magnet accreditation is lead to a culture of excellence. Your professional expertise are valued. So you can grow not only vertically. Say, I want to be at the bedside, but I still want to grow. You have these opportunities to grow in the field of education, field of clinical fields or professional areas. You are encouraged to be part of professional organizations, get some of the best practices from different conferences you attend, and bring it to your organization. And of course, yes, there is also opportunity to earn more in a magnet organization, because every magnet organization is required to have a professional practice model based on where the nursing is practiced. And also they have some sort of clinical ladder so that the nurses have this opportunity to attain their education, improve their certification. Magnet hospitals require a constant improvement in the BSN rate, certification rate in the specialty areas. So if you're a part of clinical ladder, you have every ladder you're going to earn more. For example, in our organization, level 3 to level 6, every level there's a money value attached to those levels. So it's a win-win for everything and win-win for everyone. So definitely magnet experience leads to a healthy work environment. I believe that magnet means nursing excellence and clinical excellence. It's a healthy and best work place for any nurse to work. And it also is a healthy and best care environment for patients to get their care. I want to really brag on the organization that I belong to. The importance of magnet, as you can see here. This is a large faith-based nonprofit healthcare system in the North Texas. It has got 19 hospitals and various different healthcare structures. And all 19 hospitals are either magnet designated or pathway to excellence designated hospitals. And you can see all these different coveted accolades this organization has received. 7 years in a row, ranked as #1 best workplace in healthcare, the Fortune 100 company. And being in the United States, some other things that is important is best place to work for women, millennials, diversity. These are some key things that people focus when they're choosing where to work for. So don't you think magnet experience really lead to the healthy work environment, a culture of excellence? Now, culture of excellence is something, for example, if you enter a house, you're visiting someone, no matter how beautiful that home is, within a few minutes, you kind of have that sense of culture regarding that home and for the people who are living in it. A healthy work environment, a culture of excellence, and for the organization is also something similar. As soon as you enter there or stay there a few minutes or work there a few weeks, you kind of sense that. You sense it as a patient, you sense it as a worker, or you sense it as a stakeholder. And that's what a magnet experience brings. That's all I have in this stipulated short time here. My email is here. So in case you need more information on magnet of culture of excellence, please feel free to contact me. Once again, thank you, Annie, for these opportunities. And thanks a lot for all of you. Have a blessed time.
Thank you, Ms. Vijay, for opening the gateway so efficiently to understand the healthy working environment at the magnet standards, the vital elements and the empirical outcome. The empowerment and the professional development a nurse gains with such standards are mind-blowing. Looking forward to the day when Indian healthcare organizations would be interested in seeking the same for their own nurses. And also thanking you for the description, for the positive descriptions you gave on Texas Health Resources. Thank you, Ms. Vijay. The incorporation of hospitality design makes patients and attendants at ease and reduces the anxiety of being in a new place and an environment. Hospitality and hospital are close concepts. They both refer to care, attention. The fact that these two areas are related is not surprising because they finally share the same objective: to meet the guest or the patient's need. Now, may I have the pleasure to welcome Mr. Ian Dubier to take us through healthy working environment experience from hospitality industry. Again, due to time constraint, Mr. Ian could not be here. Over to what he has to say in his presentation.
very good day to everyone listening in. And at the outset, I would like to thank the Association of Nurses for giving me this opportunity to be able to share a few thoughts with this very august gathering on what we do at Indian Hotels Company Limited to create a healthy work environment for all our associates. So Tajness is the soul of our culture. It is an implicit trust in the people that we have, which creates this invaluable relationships with them and all our various stakeholders as well. So Tajness is basically what we do and how we do it. And this is based on the 3 pillars of trust, awareness and joy, the acronym of TAJ. Trust being fairness with all our stakeholders, including our employees, associates, openness and transparency in what we do, communication, free flow of two-way communication, and building strong relationships with our associates as well. And awareness is to create a culture of awareness among everyone, whether it is participative decision making, it could be a sense of belonging that we create for our people, as well as work together to create a greater enterprise and to increase the value of the enterprise, which we do together. And joy being joy at work, and this is something that we really focus on to make our associates happy, to ensure that our associates enjoy what they do. And we have very clear guidelines as to how we train them to do what they do on a daily basis, and to derive joy and happiness in delivering the service that we do at our hotels. So these are basically the 3 pillars that form the entire culture of what we do at Indian Hotels. To dovetail a little more deeper into this, one of the very important aspects we focus on is empowerment. And this is something that we give a lot of emphasis on, because for us as an industry, we produce, we sell, we interact with guests, we get feedback, everything in the same place, all pretty much under one roof. And so it becomes extremely important for the associates to be able to take those decisions, to take those calls on the shop floor when they're dealing with our clients. And this is something that also encourages them and gives them the confidence that they can deliver, they can exceed guest expectations, etc. So empowerment is something that we really emphasize and give a lot of focus on right from the initial stage itself. The other aspect that we focus on is recognition, and I think it's extremely important to recognize people, reward people who have been doing a great job at their workplace. And we have a strong program called the Stars, where we actually recognize them right through an entire year. So it's a point-based system, and then you can actually win an award towards the end of the year, where you even we have a dovetailed awards system where you can also reach a managing director's club. It's a huge cash prize award. You get to fly in, sit with the managing director, share your thoughts, etc. at the end of the year. So these are some of the very critical, I would say, aspects that actually help a person also feel motivated at his work spot with this whole rewards and recognition program that we have. I think the other aspect also, which is pretty important and critical, is the safety of employees at their workspace. So the physical safety as well as the psychological safety. I think both are pretty critical, because one is the physical aspect. We also work in an environment where we have kitchens, we have engineering areas, we've got diesel boilers, etc. So the safety of our associates is very critical. We also have external agencies that come in and do these safety audits for us to ensure that the environment that they work in is very safe physically, as well as we look at the psychological aspect as well. All of us know what everyone went through in the last couple of years with COVID, etc. And it affected a lot of people psychologically as well. So we have very strong helplines, we have ethics helplines, etc. for people to be able to reach out in case of a need, to be able to speak to someone. You might not want to speak to your immediate boss, but you might want to speak to someone who's who's probably just wants to listen in, and someone else who's probably not part of your work environment. And that's where we have these ethic helplines as well, which really assist our employees, especially during these tough times that we are currently going through. Work-life balance, I think all of us require that, especially in the service industry. We know that it can be tough, sometimes long hours, etc. So I think work-life balance becomes very critical. And we as an industry also took this call, rather at Indian Hotels, we took this call to increase even the number of offs that we had. So we had just 4 offs in a month. From weekly offs, we increased that to 6. The working hours, we kind of focused on that to ensure people don't put in too many long hours by better planning, better execution. We brought in a bit of technology as well to ensure that we reduce that, too much of a burden on the associates. So I think all of this ensures that the associates' work-life balance also improves. And I think when that happens, then also his productivity at the work increases over a period of time. And we've actually seen that gradually happen. And it also has a telling effect on our guests. And this is something that we've also seen a very strong incline in our graph, is our guest satisfaction scores. So when we have happy employees that are motivated, employees that are energized, we've seen the satisfaction scores of our guests increasing, as well. And also, I think gender diversity is something that we focus on as a culture for our people. And we have some very strong, let's say, targets that we've set for ourselves, that we would like to ensure that there's gender diversity that's maintained at our hotels, and increase the gender diversity as well. So I think this will also help balance the entire work environment. Communication, I think this is something that you can never have enough of. So whether it is from senior leadership to middle management to the people at the shop floor, I think it's extremely critical that we communicate in a very clear, precise manner, to ensure that people understand first the strategy, the goals that the company has set, as well as to see how do we execute them at the hotel level. So I think we have many forums that we do, whether it's once a month town halls, we do daily briefings, we have a feedback system for associates also. We call that We Connect, where an associate can go to, he's got an app and he can actually send his feedback real time, and we can also see that feedback real time to see how he's feeling, his emotions, etc. So I think all of this helps the employee to stay energized. He knows he's being listened to by someone, and not only being listened to, but also someone is acting on his feedback. I think that becomes very critical from an associate, for him to have that, let's say, the bonding with the company, to know that the company does care for him. And I think if we're able to create, based on these 6-7 strong pillars that we focus on, I think this will create a very healthy work environment. We have done that. This helps us also in our retention of associates. We brought that down considerably as well this year, especially after the tough couple of years that all of us have had in the industry. But I think this going forward as well, we're trying to see whether we can use technology to ensure that we help our associates deliver better results, to ensure we get better feedback, etc., to create this environment that we call Tajness, which we are very proud of, and to ensure that we continue to deliver quality, great Tajness service to all our guests. Thank you for having me over, and have a lovely day.
Thank you, Mr. Ayan Dubier, for touching on some of the important and most magical words which are actually close to my heart, like trust, joy, awareness, transparency, recognition, work-life balance, equality, and safety. And of course, periodical surveys and town halls are very vital to understand the employee issues, all of which are very critical in hospital people management and creating positive patient experience. Thank you once again to you. Worldwide, approximately 450 million people suffer with a mental or behavioral problem that impacts their daily living. According to World Health Organization, various mental disorders are among the 10 leading causes of disability. As important providers of treatment and care, nurses are usually on the front lines of assessing and treating mental illness. Organizations can and should provide nurses and nursing students with the education and support they need to fulfill their role in patients' mental health and as well as repeat their own. Now, may I have the pleasure to invite Dr. Sai Lakshmi Gandhi, a mental health expert, to give her views on how we need to be invested in mental health. Over to you, Dr. Sai Lakshmi.
Good afternoon, dear participants, and welcome to this session on investing in healthy work environment. My session will be on investing in mental health, and let me start my presentation. So investing in nurses' mental health is very important because nurses are crucial frontline professionals, as we all know. Even in 2020, the World Health Assembly had announced the International Year of the Nurse and Midwife, recognizing the pressing need for universal health coverage by 2030. And this year too, the International Council of Nurses theme is Nurses, a Voice to Lead, Invest in Nursing, and Respect Rights to Secure Global Health. So when we are investing in nurses' welfare, we need to invest in their health, of which mental health is a very integral part. So we find that there is a mind-body-soul connect. You cannot compartmentalize mental health and physical health. Both are integrated, and we will see more and more as the presentation goes on why this is so. So I have made mnemonics to help deliver information in a shorter span of time. So I'm going to talk about what one can do at the individual level, be it the student nurse or the registered nurse, to practice mental hygiene, as well as at the systemic level. So at the individual level, this is for both student nurses and registered nurses. I have used this mnemonic self-care, where S stands for stress management. As we know, many illnesses, psychosomatic illnesses, are occurring because of high levels of stress, which nurses are not able to manage. It could be hypertension, cardiac conditions, back pain, migraine, and so on. E is for enjoying interpersonal relations. Many mental health turbulence occurs because of disturbances in interpersonal relations or because of lack of relations, leading to loneliness, and sometimes people also attempt suicide. L is for learning to switch on and off and not allow your work or your family or your me time to spill over into the other domain. F is for food, and let me talk about food and exercise together. Many of us think that food and exercise is more related with physical health, but let me tell you, it also affects your mental health. You need to eat nutritiously, and you also need to exercise, because when you exercise, a lot of feel-good hormones like serotonin are released in your body, which actually improves your well-being. C is for compassion for others. When you feel compassion and when you do good for others, naturally your mental hygiene is going to improve. A is awareness of thoughts and emotions. Remember that you own your thoughts and emotions, and you cannot blame others for the negative thoughts or the negative emotions which you are experiencing, because these are under your control. Manage microaggressions, and R is for recreation. So we need to have some form of recreation at home, or be it pets or be it gardening, music, or any hobby. You also need to talk, ventilate about what is troubling you rather than keeping it all bottled up inside you. Seek support from family, friends, colleagues, and also reciprocate, offer support when others need it. So delegate at workplace and home, compartmentalize and complete your work. These 2 points are more for registered nurses. And time management is very important, prioritizing and completing your work. This is for student nurses as well as for registered nurses. There are 2 mental health innovations which I'm going to speak about. called the mind box and the comfort bag. So mind box is a box into which you push all your negative thoughts, your negative emotions. So suppose you are at work or when you are studying and you feel a lot of turbulence in your mind, disturbing thoughts, emotions which are disturbing you. So all you have to do is say that I'm going to deal with this later, sometime today evening, and I'm going to push it into my mind box. So this is one way of showing your mastery over your brain. So never be a slave to your brain, because the brain can keep chattering the entire day and leading to a lot of fatigue. So comfort box is something which can be virtual or real, where you have a lot of pleasant memories, photos which make you feel good, or aromas or objects which uplift you. So whenever you feel low and disturbed, you can always go to this comfort bag so that you feel much better. Coming back to negative thoughts, it's important that you try to either block or divert negative thoughts so that you have more of positive self-talk, which can actually lead to high achievement levels, positive perception of self and others, and lead to rewarding relations and improved self-confidence. Remember, always ask for help when you are upset, sad, angry, and disturbed. So at the systemic level for registered nurses, this is for the nurse administrators in the hospital, I have used the mnemonic concern to help you all understand. So C is creating a HR department if you don't have one, a buddy system, mentors in the workplace. O is organizing stress management programs and soft skill training programs such as communication skills, interpersonal skills, assertiveness skills, handling negotiations, handling criticism, because many times disturbances in these lead to stress for the nurses. And encourage nurses self-care. C is another acronym, CARE, connect, ask, respond, and engage, an online platform which you can create for your nurses so that they can even anonymously try to engage with senior nurses or psychologists whenever they feel psychologically disturbed. Ensure that you provide an environment that's psychologically safe, and make sure you have employee wellness programs in place. R is for rejoicing with staff, celebrating their birthdays or success stories, planning for fun days, outings, celebrating patient recoveries so that people feel good. And N is for make sure that the nurse administrator is near the staff, accessible, available through WhatsApp groups, etc. So the systemic level for the College of Nursing, this is for the principal or the teaching faculty, where we are more like parents for these young adults. I have used the mnemonic parent. P stands for protective factors. Make sure that you have a lot of protective factors in place, like teacher counselors who are friends or allies for the young student, a buddy system in place where the senior nursing students can be friends with the first year, second year nursing students, and ensure that you have aptitude testing at entry level. So aptitude for nursing will definitely lead to a lot of job satisfaction, which can give the person relief from stress come what may. R is for resilience building through making sure that you have programs such as yoga, life skills training in the first year of the bachelorate program. Make sure that you have a no bullying policy in place, and awareness about harassment, especially sexual harassment. Ensure a comfort zone for students to talk openly, encourage empathy, compassion, and make sure that you include mental health during annual physical checkups by asking just 1 or 2 open-ended questions like, how are you? How do you feel emotionally? So this will actually be open a gateway for students to talk about what is disturbing them. Ensure healthy social media use. And N is for nurturing their strengths through organizing pro-social youth programs. T is for teachers. So make sure your teachers have undergone counseling programs so that they can counsel students, and also soft skills and stress management programs so that they can teach these to their students. So when does one seek help from a psychiatrist or a psychologist? When does the nurse administrator or the principal refer their student or their nurses? When they find that there are abnormal emotions, abnormal use of screen time, insomnia, panic episodes which are pervasive and lasting for most of the day. But also remember that small amounts of fear and anxiety are natural and are actually protective. I have also shared a few videos on yoga for nurses which will help in stress management. With this, I would like to conclude stating that nurses are shining knights of compassion, dedication, commitment, and you see them brandishing the sword of competency and knowledge, leading the war against infections like SARS-CoV-2. Nurses are the world's most precious asset. Take care of your health, both physical and mental health. So, with this, I would like to conclude by thanking Annie and appreciating the president of Annie, Mrs. Tangam Gomez, for this important conference, which is very appropriate and much needed. Thank you for listening patiently.
Thank you, Dr. Sai Lakshmi, for giving us the insights into the importance of mental health and how we have to invest in self-care, and we are the sole responsible person to take care of ourselves. Let us not wait for somebody else to come and do so. To summarize, we have heard the current situation on our working environment, the recommendations, and how standards are outside of our country for nurses, and what our counterpart in the hospitality industry is doing, and the things we need to do to improve the holistic health. Let me ask just one question to all the audience here. We attend various seminars and conferences and feel so good for just a few days that you acquired so much knowledge, and there were so many opportunities to learn new things of other organizations doing. But then, how many are really putting these things into practice and make a difference to your nurses, to your ground level nurses? For me, the nurse leader is the most crucial person who can bring in the change with her advocacy and taking stand for her nurses' rights. Let us not wait for someone else to do it for us. If you are in a position to make a change, make it, and make it efficiently and effectively. Any questions for Harita and Sai Lakshmi, Dr. Sai Lakshmi? Some questions have come here. Just give me a moment. So this question can go to Harita. Do we also need to focus and work on gender diversity? Include male nurses? You can brief on, having the advantage of having male nurses, your experiences,
Thank
please,
you.
Harita.
Yeah. Thank you, Vincy. Definitely, this question is not related to the survey which I have presented, but I don't mind taking it up as this is a, ever time asked question in the industry of nursing. So I personally feel as a nurse leader, yes, there shouldn't be any bias as far as the gender is considered. And it is a time for us to invest both in female and male nurses, because I don't personally see that, there is something called male nurses can't do or female nurses can't do. So I think it is equally important for us to have the male nurses. So that is, that way of looking at can definitely bring the strength in our profession. This is what I feel. Thank you.
Not yet have anything for Dr. Sai Lakshmi. One more to you, Harita. That is the ENPS is only 1.9. Can you explain it a bit more, please?
Very, I think it's one of the very important question in the complete study, which I have briefed. So I don't limit myself only talking about employee net promoter score. I would like to talk a little bit more into the study, though I have covered during my presentation. So let me push certain statistics first when I talk about it. So we all know around 90,000 hours of a person life they work, spent in their working at workplace. So further we look at the healthy work environment till 2018. There was nothing much actively happening, I would say. This is what the studies talk about. So between 2013 to 2018, studies again says that 57% of the institution understood the importance of healthy work environment. Out of that, only 27% could implement little bit of activity which are really related to, the healthy work environment. So when I was talking about 90,000 hours, the person on an average working in their lifetime, and I'm so sure that when it comes to the nursing, it will be much more than what it is predicted. So now comes with the question, and in the study we have clearly seen that there are a lot of issues as far as the work environment is concerned, and the serious attention is required. So we all feel so bad why nurses are leaving. Okay, and we keep talking about attrition. How do we prevent it? But what is exactly happening? This is, I think, it's an eye opener for all of us, that we have to invest much more. Okay, when I say investment, and yesterday and today, all the speakers were much talking about the theme of Nurses Day this year. That's all about invest in nursing. Now, how do we invest in nursing? Is it all about education, nursing leadership, or is it also about health and well-being of the nurse, or is it all about the safety of the nursing? I completely feel that it's all about this. Apart from this, when we exclusively look at the employee net promoter score and being very low in our survey, which again says that how do we create this culture in an institution? Who will create it? That's a big question. Now, it is all about us. Every individual must create it. It's not the group. It is not only the leader who's supposed to create it. When I say that it is everyone's responsibility, I also very much confident to say that each one of us must respect and take care of ourselves, be it a junior nurse, trainee nurse, student nurse, or senior most nurse in the cadre. The second thing is that when we create that culture of respect and taking care of ourselves, we also must ensure that we collectively create this respect and taking care of our co-workers. So that culture in the institution will make the foundation for the healthy work environment. Second, being a nurse leader, I also personally feel that we must create the opportunity to have the positivity, right? So many a times we end up in harder discussion, difficult situation. Even the study clearly says that there is a lot of verbal abuse which is happening. In fact, physical abuse is happening. Now, what do we do about it? The one who should stand and speak up that these are the issues which we have. At the same time, the positivity which we can able to create in terms of being thankful or show abundance or smile whenever we get an opportunity to smile, greet. So this warm atmosphere, I think, go a longer way. Now, coming back to the essence of the question of ENPS, so that's very, very low in our study, which clearly says that though the nurses are working, though they are complaining, but there is much more to do, and we have to really look into it. When we really mean to invest in nursing, I think it is the right time for us to invest in nursing. Nurses will not just leave you if they are happy. Thank you.
Thank you, Harita. Thank you so much. Proud of you. I'm sure your nurses must be very happy under your leadership. Now, my last question to Dr. Sai. Do our nurses trained to identify what they feel? Many times they don't even realize. Our own children, our own nurses, young nurses do not realize what they are going through. Everything they attribute to some sadness or low moment. So just want to know what they feel as stress and do something about this, or what is your experience?
Yeah,
Such a
thank
senior
you.
person you are.
Thank you, Professor Vinci, for that question. And I think it's a very important question. So I would like to actually add some research evidence to this answer, which I'm going to give. We had done research which was funded by WHO India with the Ministry of Health and Family Welfare, the nursing division. So we did survey around more than 1,000 nurses, and we did find high levels of stress. And in our discussion with them, we also found that they had difficulty in managing their emotions and their thoughts. So I do agree that yes, nurses have difficulties in managing their stress. And I'm also very happy to state that, the recently revised BSc nursing curriculum has actually introduced competencies which the student has to demonstrate skill in, of which stress management is one. And I think that's very good. Yeah. Thank you.
Thank you, Dr. Sai Lakshmi. Thank you, Annie, for having us here, and it has been great. So we are coming at mostly at the end of our AnyCon. Thank you so much. Thank you, speakers. And if anyone has got any questions to Ms. Vijay and Ayan Dubier, please post in the chat box with your mail ID. We will surely get back to you. Thank you so much.
Thank you.
Thank you, Madam Vinci and team, for creating an insight.
Education is an exceptional field. It's the only field where you have a possibility of impacting not only the lives of the individual today, but also making a change in the future. And when it comes to healthcare education, the possibility of impacting many lives, each of our students, each of the students who are going through a healthcare education context, the number of lives they impact really has a possibility of seeing the way India engages with healthcare, or the healthcare index of India gets impacted. And that is where all of us at Midvarsity enjoy working at and creating an impact on. At Midvarsity today, we are at an interesting tipping point. Not only do we have to look at how we're impacting education for doctors who graduated over the last 4 or 5 years, but we also have to prepare a curriculum and a set of courses and a methodology which will impact the millennials who are going to graduate over the next year or so. We continue to create value and impact on the ground. That is, save a life every day through every student that we graduate.
Get ready, 'cause here I come. Gonna move the mountain, gonna touch the sky, stand in the middle of a hurricane, looking right in the eye. Ain't nothing gonna hold me down. Get ready, 'cause here I come.